Hi everyone! As we're learning dental charting, I wanted to record a video about Dentrix and give you guys something to refer back to so that when we're in clinic, you can find the icons easily and be familiar with how to enter a chart note. So in my on my desktop, I have the Dentrix icon. So the easiest thing to go to is probably going to the patient chart. And that's the tooth icon here on my desktop. So I'm going to double click the tooth icon, and then it's going to prompt you to sign in with your user ID and your password. So you'll go ahead and enter those user IDs that you guys have already created a few weeks ago in clinic, and then you'll be able to enter the program. And as soon as that comes up, you'll have this screen here where you can select a patient. So I'm going to go ahead and select my patient. And then that's going to open up the chart. I'm going to go ahead and maximize the view here so you guys can see the chart in full. And let's see here. I want to see the clinical notes, and let me do this one more time. There we go. Clinical notes. So if I click on clinical notes, I'm going to go ahead and make that big now. This is the screen that you go to right before you go to begin your clinical note. But before you do create that clinical note, you want to come up to the top in the middle here where it says select provider. So be sure to select your provider number before you create your clinical note. So then when I come down to, when I hover over this icon here, it says new clinical note. I'm going to click on that. It's going to enter today's date and then also the time that I'm entering it, and then it's also going to include my provider number. So this is really essential so that we know who provided treatment on what day for this particular patient. So that's really important to make sure that you're including your provider number. Now, when we go to start creating that clinical note a little further, we want to click inside the note section and then click on insert date and time. So that's going to time stamp it for us. And then you could enter down to go to the next line. And then you can see, I'm going to make this just a little bigger here. You can see all the way to the right here, there's going to be these other, this list of icons. So medical history, EOIO, radiographs, so on and so forth. So we can double click on the medical history. That's going to open it up, and then this is a really good template for you guys to use. So this is the order that it should be in when you're creating your clinical note. So I'm going to double click on medical history review, and you're going to see there's a box that opens up and it's blank. So you can enter any significant information here. You can insert the patient's vitals here. This would be good, and then you could click OK. You can, and then you can see how it entered the reviewed medical history and then a colon, and then whatever else you would have entered in that box would show up here in the clinical note. So then I'm going to come over and I'm going to double click on chief complaint. So this is something you always want to ask your patient. Ask them if anything is bothering them, or do they have any concerns regarding their teeth and or regarding their mouth. So this is where you would enter that. Now, while we're working on each other, you can insert clinical experience or lab experience as the chief complaint or the concern for the patient. So then we would say okay, and then it would actually insert chief complaint. Then we're going to go back to the list, and then we'll click on EOIO, because now we're going through that sequence that kind of follows that list resource guide that I provided for you guys in clinic. That kind of goes down the list of steps to do when you're in a patient appointment. So now after I click on EOIO, I'm going to double click on extra oral, and then it's going to take me through a variety of different questions. So it's going to take me through breath, and you can click within normal limits. That's what WNL stands for, or abnormal. And then it's going to take you through the soft tissue, and you can go through the prompts here, and once you're finished, you will see that it's going to show up in the actual clinical note. So all of that I just clicked through just showed up right here. If you need to add, if anything is abnormal, then you would add any additional note next to that section or item. Then I can go into my intraoral exam and do the same thing. So it's going to prompt you for several different the steps through the intraoral exam, and then you're going to click within normal limits, WNL or abnormal. And then once you get through all those prompts, you're going to see it's going to go right into that clinical note. So I want you guys to start using these templates so that your clinical notes will have all of the information that needs to be included. After we do the EO-IO exam, now we're going to be going into the gingival assessment. So we learned about gingival assessment in week 6. So we're going to double click, we're going to skip radiographs because we're not quite there yet, but we can double click on periodontal assessment, and then we can double click on periodontal assessment and we can just say okay. And it's gonna, you can enter any additional information if needed there. But mostly I wanna start getting you guys familiar with the gingival description. So this is gonna prompt you through that color, contour, and consistency for your patient. So you can go through and you can select how their tissues are presenting. So you can go through the color, the contour, if there's anything that you need to include. If the margins are rolled, you would indicate that here, and then you would continue through the papilla, contour, consistency. And you'll see on this one, and I think on the other ones too, where it talks about local, that's in regards to localized. So if there are any localized areas of maybe some redness or some localized area of edema, then you would indicate it here. And then you're going to also indicate embrasure types. So UR is for upper right, UL is upper left, LR is lower right, and LL is lower left. So you can select through that list if they have embrasure type 1, type 2, or type 3 in those 4 quadrants. And then that would all come up inside that clinical notes. You can see that here. So I just wanted to kind of walk you through with these templates so that you can start utilizing these templates in the clinical note going forward in clinic and lab. So once you input this information, you also want to include what you did on that day. So you would put TV, which stands for today's visit, and then you can input what you completed that day. So you could put EO-IO, gingival description, probed maxillary teeth, and recorded in perio chart. And then you would put NV on the next line after you completed all of the items or entered all of the items that you did that day. And then NV means next visit. So next visit would be continue assessments, or it could be continue probing and recording in perio chart. Okay. All right, so this is the way that your clinical notes should look moving forward. So I'm just going to scroll back up so you could see. First of all, the provider number is indicated. You want to make sure that you enter your provider number into the chart before you create this new clinical note. You're going to input the date and time stamp. You're going to go over to the right and utilize the templates. You'll have reviewed medical history with your vitals included in that area, the patient's chief complaint. You'll have the extraoral exam, the intraoral exam, and then the periodontal assessment and gingival description. At the end of your note, you'll have TV for today's visit and NV for next visit. We will continue to learn more about Dentrix and about charting, please become familiar with this process and more information about Dentrix and how to use Dentrix to come.